Hi, this is John Goldblum. I wanted to talk about common morphologic patterns in soft tissue tumors. I like to teach soft tissue in the way that I sign it out. And the way that you sign out soft tissue, at least the way that I sign out soft tissue, is by looking at the predominant pattern under the microscope and then going off in a certain direction with a certain differential diagnosis, and typically using very specific ancillary diagnostic tests, including immunohistochemistry and molecular pathology. So I'm going to talk about some of the more common morphologic patterns in soft tissue tumors. This is really a two-part lecture. So I'm going to start off with, these are the four patterns that I'm going to be really talking about. The first pattern, which is pretty common, I'll put in quotations as an MFH-like pattern. MFH standing for malignant fibrous histiocytoma. And I put this in quotes because, as many of you know, and if you don't know, I'll be getting to this point, the term MFH is sort of antiquated. It's been looked down upon in soft tissue since about the mid-90s. In essence, the term MFH has been supplanted by the term undifferentiated pleomorphic sarcoma, or UPS. Still, you can use the term MFH-like as a descriptive term, and that's exactly how I'm going to use it. You'll get my point when I get to that point in the talk. The second pattern that I want to talk about is fairly common also in soft tissue, and that is a highly cellular spindle cell pattern. Third pattern, probably the most annoying of all these patterns, are mixoid soft tissue lesions. Surgical pathologists encounter soft tissue lesions with mixoid stroma not infrequently, and unless you deal with soft tissue with some regularity, there's a tendency for the practicing pathologist to get a little bit antsy when one sees a mixoid soft tissue lesion. What I hope to do is not to give you a summary of every single mixoid soft tissue lesion, but basically an approach to a soft tissue lesion which has extensive mixoid stroma. And then finally, the last pattern that I'm going to talk about is the round cell pattern. Often when I talk about the round cell pattern, I see people in the audience who sort of put their heads down and sort of say, now it's time for me to take a nap because I don't see pediatric tumors. I work at an adult hospital with very little or no pediatric pathology. And the fact of the matter is the round cell pattern is the most common pattern that one sees in pediatric soft tissue tumors. But the fact of the matter is also you see it as a fairly common pattern in adults. And more times than not, when I see a round cell morphology, it's arising in an adult patient, not a pediatric patient, at least at my hospital. So again, the focus of that portion of the talk will be not to discuss every single round cell tumor. There's way too many to discuss even in a 1 hour or 2 hour lecture, but rather an approach to a tumor with a round cell pattern. So this is what I mean by the, quote, MFH-like pattern. It's a highly pleomorphic malignant neoplasm, and most pathologists who see something like this, their first, second, and third thought would be that this is a sarcoma. And the fact of the matter is, in this particular case, this is a sarcoma. It's a high-grade sarcoma, as you might guess. And a number of ancillary diagnostic tests were performed on this particular tumor. All I can tell you is that there was a little bit of staining for smooth muscle actin. All of the other markers that were performed were negative, including epithelial and melanocytic markers, as well as a number of other sort of, quote, mesenchymal markers. Again, just focal smooth muscle actin immunoreactivity. And in the end, this high-grade neoplasm was felt to be a high-grade sarcoma, did not have a particular line of differentiation, and was by exclusion referred to as an undifferentiated pleomorphic sarcoma. But again, back in the old days, this would have been simply referred to as an MFH. So this is the kind of pattern that I want to discuss over the next few minutes.